You know, I've had back pain for years, and always in the past, we were able to alleviate the pain and the problem with the proper physical therapy. Thank goodness, because at one point it was suggested that it might be time for surgery at that time. But this last time, I felt like it was probably different. The pain was worse, the numbness was terrible, and it just kept progressing a lot, very fast. I'm a Weight Watcher. I walk to keep fit and to keep my weight down, and I love walking. I'm an outdoor person, and I was becoming less and less able to do that. I used to walking 3 to 5 miles with no problem at all. I was getting so a quarter of a mile was painful, and so much numbness that I would actually start losing my balance. So it was getting to be very serious. I couldn't do my walking, for one thing. You know, I have taken a lot of mission trips. I led a trip to New Orleans after Katrina. We cleaned out 2 houses. That was very tough physical labor. And that was another one of my considerations in wanting to have the surgery. I don't want to stop doing that. I went to my physical therapist and she gave it a try, but she didn't have a lot of hope either. And after a very short period of time, it was determined that physical therapy wasn't going to do the trick. And she right away recommended Crystal Clinic and Dr. Brower. And before I knew it, I had an appointment and had an MRI and was in Dr. Brower's office.
In our practice, we don't tell patients that they have to have an operation, and we don't try and talk people into having surgery. I actually operate on a fairly small percentage of the patients that I see. I think patients can always make a better decision as to what's right for them if they have good information. Ron was having some weakness in his legs from the condition in his back from his spinal stenosis, and it was really affecting his ability to do his recreational activities. He likes to walk with his dog, and he's a very active hiker, so he really felt like the problem was unlivable because he couldn't do the things that he wanted to be able to do. And I think that's where surgery becomes appropriate for patients when they really feel like their problem is not livable for them. Surgery is meant to take the unlivable and make it livable. Ron had surgery on April 11th of this year, and he had a decompressive laminectomy. So we removed the bone and ligament that were pushing in on the nerves across 2 of the segments in his low back, and we also fused those 2 segments, those 3 segments really together, because he had vertebrae slipping out of place. So this stabilized the abnormal motion in his back as well as giving the nerves some room to breathe to function better.
8 weeks ago, before the surgery, stairs were a big problem, and walking any more than 1/8 of a mile or so was a big challenge that I really couldn't hardly do at all. Now, it is no problem at all. I walk for hours at a pretty good pace, and I enjoyed every bit of it. Was not sore during the walk, was not sore after the walk. I have no pain, no numbness now. That's wonderful. Stairs are no problem. I have 2 flights of stairs that I go up every morning when I get to work. I park in the basement of the parking garage, and I can just sprint up the steps. No problem at all.
For patients who have spine problems, they need to exert a little bit of care with what they read online. There is unfortunately a lot of marketing going on online with things that may or may not be very helpful for them, and some things that are really on the fringes of what's appropriate for the patient. I think seeing someone who's conservative and who really understands what their problem is and can make a good diagnosis for them and then lay out their options as to what they can do. Good information is the best thing for the patient to have to make a good decision for themselves.
I think the Dr. Brower and Crystal Clinic and all their skill and their caring have just given me a new lease on life. I just can't express how thankful I am that they're there and that they've cared to do this for me. Whether it's leading a mission trip, leading a Weight Watchers meeting, which I love to do. I stand on my feet to do that and move around. I'm a very animated speaker. I'm looking at a job where I will be teaching all the time, and I'm a very animated teacher. I couldn't have even considered doing that if standing on my feet was impossible to do for a period of time. So I just thank Dr. Brower and Crystal Clinic for giving me my life back so that I now look forward to many, many more years of doing the things I love to do.